Salams and welcome. Thank you for joining me in part 13 of breast cancer awareness, and we're looking at the basics of breast cancer. Another component which some people forget is this important psychological aspect of breast cancer, which is the social impact. Breast cancer affects relationships and the social impact on the patient. Breast cancer can strain relationships with the partners, with your family, and with your friends, leading to feelings of isolation or withdrawal. It all depends on the patient. What I've learned in my own life is that whenever you are affected by a crisis in your life, there will be some people who will stay with you, and many people will leave you. And many people who will leave you, you will then find yourself totally isolated or in a state of withdrawal. There are some cultures which are very supportive, and I know the Indian cultures or the Arab cultures and many black cultures are very supportive. And you would find when a person has cancer, then many people will come to visit or phone or send messages of support. And this can also then be a strain on the caregivers. And an important aspect of the social impact, which many people forget, is the role of the caregiver. For example, if a woman has breast cancer, then the husband or the children become the caregivers. And many people will ask the wife, "How are you feeling?" But they will forget to ask the husband, "How are you coping?" Or if the husband has cancer or has got a chronic disability or has got other types of problems, they will ask the patient to ask the husband, "How are you doing? Are you coping? Are you okay?" But they will forget to ask the wife, "How are you doing?" Because at the end of the day, she is looking after the patient or the children are looking after the patient. So we must not forget the impact of the caregiver. Some people can afford it and they will have their own nursing caregivers will be at home. And in some cases, when people cannot manage it, they will then transfer the patient to a professional hospice society. And it all depends on this individual case of the patient. But social withdrawal is a reality. But today, fortunately, with social media, this has taken away that sense of loneliness from many patients. Many patients can now spend many hours on Instagram or YouTube or Facebook or TikTok or on the fabulous various Netflix series that are available. But please try and find something which can keep your mind, body, and heart occupied. And some people go deeply into spirituality. So whether you're doing an increased amount of Quran reading or dhikr, Allah subhanahu wa ta'ala tells us in the Quran, "Fadhkuruni adhkurkum." You remember me, I remember you. So we need to remember our Creator. We need to remember Allah subhanahu wa ta'ala all the time. "Fadhkuruni adhkurkum." You remember me, I remember you. So some people will go deeply into spirituality. Some people feel that, okay, let me just go for outing on weekends. I need to go to the movie or to go to warm baths for a swim or just to chill out at the shopping mall. Even if you go alone, go and have a cup of coffee by yourself or watch some series on Netflix. And in the old days when I was growing up in the 60s and 70s, I remember I was in school. Look, I was born in 1959. So in school, I remember there was a long series that we used to watch was, what is it called? Dallas. Dallas, and another one was called Rich Man, Poor Man. And then the other one was called The Thornbirds. And the other one was, I forget the various names, that Japanese one, Samurai, forget the name of the Shogun the Samurai. Right, so these, we used to now wait every week. Every Tuesday, we used to wait for an episode. So we watch the episode today, then we wait for next week Tuesday for another episode. Whereas today on Netflix, you can go through binge watching. You can watch the entire 100 episodes over a weekend or over 3 or 4 days, and that will take your mind off the illness that you are going through. Okay, stay well, look after yourself. Look, each individual patient is different, and I cannot dictate to you what is right and what is wrong. Remember, you are a human being. You are a unique human being. There is no one else in the world like you. There is no one else walking in your shoes. So you must do what makes you feel good with your condition. Don't try to please the people, please your Creator. Stay well, look after yourself. Alhamdulillah.